Welcome back. And now to shed light on whether Indian consumer laws should evolve to allow more choice for consumers, it's an honor and privilege to welcome and introduce Dr. K. Madan Gopal, Senior Consultant Health, NITI Aayog, National Institute for Transforming India. Dr. Gopal, over to you.
Okay, it's a very interesting thing. I would be just sharing some insights on the patient-centric, how we can have a patient-centric consumer, patient-centric healthcare from consumer point of view, so that the harm which happens to the patients as consumers can be reduced. As we all know that the health services in the country, there is a notion that maximum of the health services happens in the private sector. 70% of the expenses happens in the private sector. The government is also doing its own bit. If you look at the systems elsewhere, like the NHS system in UK, where it is patient-centric approach is there, and the patient is, if you are thinking about me, you should be thinking about me, not without me. That kind of approach is there. And we have also tried to see that how that approach is built into our system. Though we have regulations, we can at least ensure safety for the patients. But apart from the regulations, in the regulations sphere, we have having regulation for drugs, we are having regulation for medical practice, we are having regulation for the health facilities. But having said that, are these regulations adequate? Can this regulation ensure adequate quality of services provided by the institutions or the practitioners, or can I get a good quality medicine? These are the questions which needs to be answered. It's not simple just by enforcing acts for the protection of the people you can have. We do have we need to put efforts for increasing the capacities as well, capacity for enforcement of this regulation. That's one aspect. The other aspect is how far the consumers, that is patients, they are involved in management of the healthcare, so that the patient-centric approach is there, and the harm reduction, the harm which can happen to for a particular way of method or SOPs which have been practiced by a particular institution, that can be reduced. This is happening in the South American continent. It is happening rampantly. That means the patients are part and parcel of the decision system, as well as in NHS it is happening. We have also made some efforts in bringing the patients into our decision-making process. In the public sector, you have seen that the communitization of health element was introduced in the National Health Mission, wherein the representative of the people, they are a part and parcel of the management committees of the health institutions, right from the primary health center, community health center, and the district hospitals. At the village level also, village health and sanitation committees are there. This is the involvement of the people, so that they know that what is being offered and how they can contribute to the betterment of the services. These are still ongoing, work is in progress, and the results are quite encouraging, because if the people participate and try to evolve, try to contribute to the decision-making process, the results are quite obvious, and things will happen. I'm just coming to the example of this during this COVID time. We all grappled with the issue that what to do. Many of the patients, many of the people, they have participated in the clinical trials for the medicine as well as the vaccines. Right from the beginning, if we have involved the patients, because in this clinical trial, we have to involve them. That's an example how things can move, how things can happen. Right from the clinical trials phase, the patient knows that what is in store for him. What if something goes wrong, what are the steps which would be taken? Many of the private hospitals, now they are having a citizen-centric approach, but more or less it has been directed by the managers who are managing that institution. It's more or less a provider-specific and provider-dominated healthcare services in the private sector. We have to see that if I'm thinking about a patient, if they are involved right from the beginning, then you can see the results which are available, which the many studies have happened. The results have shown that if a patient-centric approach is there, the readmissions for the similar situation is more or less reduced. Apart from that, the outcomes of the disease are also discussed, and the outcomes are also enhanced. That means you have a better outcomes with the patient family, and all the members of his family, they are involved in the treatment and care. That approach is there. A little bit is available in the private sector, in the public sector. In the private sector also, it is now increasing. And if you look at the health policies which are there, the health system is expanding. The population is expanding, system is expanding. But you have to see that how the regulations which have been enacted earlier, they have been taken into account for the patient safety and other things. We do have many account. We are having Consumer Protection Act, but that has resulted in costly treatment and other things. That's the other viewpoint which people are. But essentially, it was enacted to prevent the malpractice and the negligence from the doctor's side. The objective was that, but as a result and consequence of that, many other challenges have been thrown up. For the patient-centric approach, we do have some quality standard, because for the regulating the health institutions, we have the Clinical Establishment Act. At the local level, you are having Nursing Home Act. But passage of Act throws some responsibility to the professional organizations also, because if the professional organization come over and they ensure some quality standards for the participating members, then things can happen. You see the example of Germany and other places where the professional organizations, they come forward to help the member organization to ensure a certain set of standards, so that the safety and the rights of the patients are being addressed. The other aspect is that we have to keep in mind. That means we have to ensure that patient is in the center for all the care. A constant dialogue is to be there. It's not that if our measures in the village health and sanitation committees, they are not working, if the health and development committees and the public institutions, they are not working, but at least we get feedback from these people that what kind of treatment and what kind of things they require. We can set in some matrices and be responsible whether the system which we have created, whether it is working or not. You look at the example of the TB program. In TB, you are having a feedback mechanism. In Mera Hospital program, which is there in the public institution, you have a feedback mechanism from the patient, so that if some quality issues are there, or if some patient concerns are there, that can be addressed then and there only. And apart from that, we are trying to see that how the metrics which are generated from the patients, they are being used for gauging the performance of that institution, so that more safety aspects can be built into the patient care. And apart from that, we need to see that we have to evolve a mechanism where the patient voices are heard. It's not that the provider and the institution manager, if they are saying something, because right now it is provider-centric and the institution manager-centric. You need to see that how the patient voices are heard. The policies are there. All the policies, they talk about patient-centric measures and mechanism, but we have to see that how this becomes a reality. We have made an attempt, as I've already mentioned, in the things which have happened in the public sector. In the private sector also, we see that how a patient-centric patient safety thing is embedded into the organization policy. We do have patient-centric quality standards, which are the NITI standards. The other standards are also there. They are all patient-centric. We see that how the institutions come forward, how the professional bodies come forward to see that the safety aspects which are meant for patient safety are embedded in the institution's role and responsibilities. Apart from that, we have to see that how the malpractice and the negligence is avoided. If a proper discussions happen, if a proper engagement happen, then obviously excessive diagnostics, excessive everything is avoided. That dialogue is missing. We have to see that how a continuous engagement with patient from the beginning is ensured. the core of all this thing to end, there has to be an interaction between the healthcare and the patient, so that as the things are evolving, as the sophistications are evolving, if the patient is aware, if the patient is well educated, so lot of problems, lot of regulations and other things, they would be there, but they require. It's because we are continuously not engaging with the patient. The moment we start engaging with the patient, more accountability and transparency will set in, as well as readmissions, and the follow-up would be very easy for us. I will stop here. Thank you very much for this opportunity.
Thank you so much, Dr. K. Madan and Gopal, for your insight on should Indian consumer laws evolve to allow more choice for consumers. Some great insights from the government perspective. We wish you and NITI Aayog the very best going forward.